In this video, we're going to get to know more about postpartum depression. What is it? Why is it important? What can you do to help if it develops in your partner? Just to give a quick overview, postpartum depression and its variants are thought to occur in roughly 1 in 6 women, so it's very common. It's important because it can have lasting effects on everyone in the family, the person who gave birth, the baby, and the partner. Although it can be tricky to suss out, there are signs and symptoms you can look for. And it's important to bring those signs and symptoms to your OB or your midwife or whoever is on your care team. So, when we run into mood or anxiety issues during pregnancy or after birth, often the term that's used to describe them is postpartum depression. But that name is kind of a misnomer. That name implies one condition at one point in time, depression after birth. Really, the term that's often used now is peripartum mood and anxiety disorder. I'm going to use these terms interchangeably today, in part because that's how it's done in the wild. That's what you're likely to encounter at your doctor's appointment. But know that what this term really captures is mood and anxiety disorders both during the pregnancy and after delivery that can occur for up to a year after birth. Oftentimes, conditions with depression also involve anxiety. Peripartum mood and anxiety disorder can include a constellation of different conditions. Let's start first with postpartum depression. That tends to be characterized by feelings of persistent sadness, feelings of worthlessness, and loss of pleasure in daily activities. To get a bit more granular, according to the DSM, the Bible for psychiatry, postpartum depression is considered present when 5 symptoms occur for more than 2 weeks. And the list of symptoms includes things like depressed mood, sleeping too much or sleeping too little, slowed physical or mental activity, loss of energy or fatigue, or thoughts of suicide. Currently, we don't know what causes postpartum depression or any of the other mood disorders, which is true of these conditions outside pregnancy as well. It's likely that there are a number of factors, including chemistry changes in the body and social factors. Another possible mood or anxiety issue is postpartum anxiety. That involves things like excessive worry, like being overly cautious, checking things repeatedly, being controlling, feelings of restlessness, an inability to relax, racing thoughts, obsessive fears, and intrusive thoughts, which are ideas and images that come to mind uninvited and often unwanted. And finally, the last condition we'll talk about is postpartum psychosis. This is a rare but severe condition. It occurs in roughly 3 out of every 1,000 births in the US, and that one is characterized by hallucinations, delusions, and disorganized thinking. These symptoms are a serious issue because they can lead to a new mom trying to take her own life or the baby's life. Postpartum depression, postpartum anxiety, and postpartum psychosis are not to be confused with a condition typically referred to as baby blues. Although that's a bonkers patronizing name, it's super common. Most women encounter this temporary form of depression that dissipates when hormones level out. I saw one statistic that said 85% of new parents experience this. It usually involves lots of mood swings. You're happy 1 minute and crying the next, and it can last for up to 2 weeks, but it's generally more mild and it doesn't impair function. If there's any uncertainty, you can and should bring symptoms to the doctor or midwife. Why is this important? Why do we care about this condition? First, let's look at how it can affect the baby. Postpartum depression can lead to poor maternal infant bonds. It can keep a mother from feeling attached to the baby, which can influence how she interacts with the baby. As you can imagine, this could lead to negative parenting practices. A very negative attitude directed toward a baby can impact growth and development of the child. It can contribute to a failure of breastfeeding. Breastfeeding is a complex relationship, and postpartum depression or anxiety may hamper a mother's emotional ability to continue with breastfeeding when it's challenging if she's already struggling with feelings of low self efficacy. As you can imagine, there are also effects of peripartum mood and anxiety disorders for the adults in the house. What about the mom in particular? As adorable as a new baby can be, they also tend to be lots of work, and adjusting to that workload can be challenging, especially with a mood and anxiety disorder. This combination could contribute to things like marital discord. And another serious consequence for the mother can be thoughts of suicide. It's a devastating consequence and is among the leading causes of maternal death, especially during the first year postpartum. More good news about these kinds of conditions: partners can develop postpartum depression too. There's evidence that if a new mother has prenatal depressive symptoms or postpartum depression, her partner will be at increased risk to develop postpartum depression. I'll briefly quote and link to an essay by Kevin McGuire, who runs a dad blog, who wrote about his experience with postpartum depression. He writes, I spent most of the summer of 2019 wondering what was wrong with me and why I didn't love my son. He was born 3 months earlier, happy, healthy, and everything we could have asked for. After settling into the unique cadence new parents face, moving abruptly between adorable vignettes and constant sleep deprivation, I started to sense something wasn't right. The thought didn't arrive fully formed, a dull background static, initially attributed to exhaustion. But when it remained, after even the occasional 8 hours of sleep, I started to question what I was feeling. Super important question. How do I identify it? So, in general, postpartum depression, postpartum anxiety, postpartum psychosis, all these things last longer than the baby blues. So, if you see these symptoms after 2 weeks, consider if what you're seeing is something different and less transitory. So, what's the current process used to detect a peripartum mood and anxiety disorder? Right now, during the pregnancy, an OB or midwife, and after delivery, usually a pediatrician, will give the mom a survey. And based on her responses to that survey, will determine whether this person is potentially in need of help with some kind of mood disorder. This system is thought to miss a lot of cases. Surveys are not a very exacting tool. So, one reason that they might miss cases is that women can't always identify a mood disorder in themselves. They may just think, this is what I feel like after I give birth or while I'm pregnant. This is just what it is. We've been conditioned not to ask for help. So a lot of women think, I wanted to get pregnant. I wanted this baby. So everything that comes with it are things that I should shoulder. And another potential reason is that being unhappy after birth might suggest that someone isn't grateful for a healthy baby and therefore unfit to be a mother. One way to assess how effective these surveys are at ferreting out patients who need help is to do research on them. Currently, there are no good randomized controlled trials that show that the screening has any benefit at all. And that kind of makes sense in that a woman is often with her care, someone from her care team for maybe a 15-minute appointment. It's really hard to suss out this complicated topic in such a brief amount of time. So, you as the partner have to be involved. You have much more information and much more time with your partner to assess if any of these symptoms are showing up at your house. Again, we can't stress enough how important you are in this part of the process. You may not have felt a part of the process during the pregnancy, you may have felt sidelined during the birth. Now is the time you can really step in and make a huge difference. So let's look at some of the common risk factors. You're more vulnerable to postpartum depression if you had a mood disorder like depression or anxiety before pregnancy or had these conditions in pregnancy. Other common risk factors that were identified were things like high life stress. What does that mean? That includes complications during pregnancy or in the birth, job loss, or death of a loved one, something like that. And another factor is a lack of social support. Tending to a newborn is a lot of work. And although many of us have been conditioned to not ask for help, as I mentioned in the previous slide, postpartum is definitely a team sport. It's a job that requires more than one person. What can be done if a mood or anxiety issue is suspected or identified? Most importantly, bring this issue to a doctor and they can assess what treatment makes the most sense. It may be tricky for doctors to identify this problem in people, but once it's identified, there are a number of different things that they can do. What might help look like if you do seek it out at your doctor's office? The doctor can prescribe a variety of things, including therapy, certain medications that are safe to take in pregnancy or while breastfeeding. They can suggest supplementation with things like vitamin D or DHA. When these are in low supply in the body, they may contribute to the probability of developing depression. Or alternative approaches like yoga or acupuncture are group classes that provide a sense of community. Most importantly, the number one takeaway is that you can make a big difference in this area. You and your partner and your care team can manage a peripartum mood or anxiety disorder.